Hello, everyone. Welcome to Mom's Corner. I hope everyone's doing well today. My name is Zainab, your host. I'm so sorry that you can't see me. My camera decided to not work at the last minute, of course. But I'm so excited to be here with you today, and I will intermittently just be letting people in if I get interrupted. Sorry. We want to thank everyone for joining us. You could be anywhere and doing anything today, but you chose to be here with us, and we are so appreciative of that. Thank you for being here. Mom's Corner, for those of you who are new, is one of the many programs under the umbrella of Global Perinatal Services, or GPS. And Global Perinatal Services is a nonprofit doing amazing work and changing lives every day. Our mission is to provide community-based doula services that will educate, respect, and empower low-income Black, refugee, and immigrant women and their families during pregnancy, birth, and into early parenting. Mom's Corner is a space not just for moms, but for all women folk, because at GPS, we believe that motherhood is an extension of a woman's identity and not the definition. Mom's Corner, since the pandemic, has become not just a space where we come to find empathy, support, and camaraderie, but a safe haven and access to so many critical resources in our communities. Today's topic is stress, the impact of stress on health. And I will give the floor to our doctors to address it. If you should have any questions, please feel free to drop it in the chat box. I will be.
Okay, thank you so much, Zainab. I can start us off here. Give me 1 second. So our topic, as you said, is the impact of stress on health. This is such a broad topic, and so we kind of we tried to focus it a little bit. We have myself, Dr. Abraham, Dr. Hemphill, Dr. McClintock, and also Dr. Miller, who we were lucky enough for her to join us at the last minute. So happy to have her as well. Moving on to what is stress. Stress is a general term that we use to describe how our body reacts to certain situations. I'm sure that we've all heard of the fight, flight, or freeze response to any like stressful events. And this is kind of a response that starts in our brain with a lot of different chemicals like adrenaline and cortisol, and has kind of a cascading hormonal effect that affects our heart. It can increase our heart rate, our breathing rate, blood pressure, and many other things. My question for you all is, what are some examples of stress in your life?
Raising children.
Great. Let's keep it coming. I know we all got, financial stress. Yep. Work. Feeling
like there's no time for the things that you want to do to decompress.
Absolutely.
Being late to things.
Exams, yeah. Great. Thank you for participating. So we have examples of like, some examples that people gave were really great examples of like short-term stress. And not all stress is bad. Sometimes a little bit of stress, a little bit of that cortisol, adrenaline helps us get through the things that we need to do and perform. And sometimes we are exposed to long-term examples of stress like poverty and long-term financial worries, discrimination, and other traumatic events. With poverty and like financial worries, depression is more common in women whose families live below the federal poverty line. women in poverty who care for children or other family members, as well as themselves, may experience more severe stress. As women, we all are face discrimination from our gender at our work and other places that we like, and almost every single thing that we do. And if you're a woman of color, that is actually compounded. Like those parts of our identity are not additive but multiplicative. So women experience discrimination based on their gender, their race, ethnicity, sexual orientation, and all these stressful events, such as learning a new culture if you are a refugee or an immigrant, or experiencing discrimination in any of other ways like that, adds to our risk for depression, anxiety, and other impacts on our health. Speaking of, like, moving on to like specifically talking a little bit about traumatic events, and there's a lot of research in trauma and post-traumatic stress disorder, but many women that are coming to the United States as under like a refugee status or seeking asylum, or even like in any other avenue for or reason for coming here, in addition to women that were born here, might also have experienced traumatic events. And this can range from something like being in an accident. It can be witnessing or knowing about a traumatic event of someone that you care for, this vicarious trauma, anywhere from like a physical or sexual assault that happened as a child to recently if you're an adult. All of these can affect your health in negative ways. So yeah. Does anyone have any questions about that?
Thank you, Jazzy. So we just heard some really excellent examples from the group about short-term stress, and then Jazzy provided, or Dr. Abraham provided quite a few really excellent examples of categories of long-term stress. And so as you can see, stress can manifest itself in small ways in our lives and in very big, long-term, impactful ways as well. And I imagine everyone on this call has at some point felt stress, whether short-term or long-term. Another opportunity for group participation. If you want to either say out loud, unmute yourself, or put in the chat some symptoms that you have felt in yourself, in your either mentally in your mind or emotionally or physically in your body, that you have noticed when you've been under stress. And I'm seeing insomnia in the chat and headaches, two really excellent and common examples. Heart palpitations, yeah. I think that oftentimes one of the first vital sign that we see impacted when we're under stress is our heart rate goes up, maybe our breathing changes. In the chat, we've got anger, sadness, frustration, sweating. So a lot of emotions that I think we think of as heavier emotions coming along with stressful situations. Sweating, that's another physical manifestation. Nausea and acne, yep. Craving. So oftentimes it'll not only impact our sleep, but impact whether we're eating more or less than we otherwise might be. So those are all such good examples. Some other ones that I think of would be getting forgetful or having a lack of focus because our mind is trying to juggle too many things. Irregular periods, yeah, that's another way that stress can have like a real physical impact on our body. That's such a good example. It might make us really tired, impacting our energy. Abdominal pain is another one that I often hear from patients. And then I think some of, just in line with some of the emotions that were already mentioned in the chat, but like that feeling of being overwhelmed or like you don't have any control. And as Dr. Abraham mentioned in the beginning, sometimes stress can be motivating and can help us, but I think there's a point where it gets to be too much, and then it maybe is no longer motivating. So there is definitely a spectrum there. Worry is also a great one. So yeah, here is a list of ones that many of these we talked about in the group sort of highlighted I think some of the most common ones, some of the ones that can really impact us in negative ways, other ones that weren't mentioned. So oftentimes substance use is something that folks will turn to when they're feeling a lot of stress and either not having access or time to use coping strategies to deal with stress, or not knowing what coping strategies might work for them. Substance use is really a common one. And then similarly, the examples at the bottom, having less interest in things that you once enjoyed, that's also something that we ask people when we're screening for depression. So seeing that connection between increased stress and being at risk for things like depression and anxiety.
So we've talked a lot about the different symptoms of stress, and I just want to pose some questions to everyone who's here. And you can either just think about it in your head, or you can use the raise your hand function on Zoom, or you can type in the chat. But I'm wondering how many of you think that you're under chronic emotional stress? Yeah, so you have some me's. I think so too for myself. So it seems like a lot of people consider themselves some chronic emotional stress, and we've talked about how that stress can come from a lot of different places. Yes, Taylor, thanks for sharing. And then I want you to think about if there are any issues or conflicts that you're currently trying to resolve in your life. So just take a few seconds to think about whether you have any conflicts you're trying to solve or issues in your life that seem unresolved. And then the last question is, does anyone think that there's an impact of that stress on your own physical health? And if anyone is brave enough to share, I'd love to hear how you think that sort of that emotional stress manifests in impacting your physical health.
Yeah, for me, I know I have chronic migraine. And so whenever I'm stressed, it's literally like one of my triggers. So I have to ensure that I'm not, I'm not stressed, or else it just goes downhill from there. And I could be down for several days as a result.
Yeah, and migraines are really debilitating, and sometimes you can't even control that stress. So thank you for sharing. Must be really difficult.
Yeah.
Okay, so someone else shared that they have IBS, and so that stress really affects kind of their GI system. That's a really real thing for a lot of people. I saw someone in clinic the other day for whom stress was a trigger for their seizures. So they were really debilitated by having more stress in their life. Thank you everyone for sharing. Does anyone else want to share? Oh, hi, Faiza.
Hello, hello. How's everyone?
Great. How are you?
I'm good. It's nice seeing you all again. Yeah, I just wanted to add on, for me, it's irregular periods. My periods will start, I'll start spotting if I'm under stress, and then I will also start, having sort of a sleep, issue with sleep. Like I usually am, I fall asleep easy and I stay asleep. But when I'm under a great amount of stress, that's something that gets messed out as well. And and definitely heartburn too. I have noticed I have a jar of pub bed. Whenever there's, that's something I've also noticed that.
Beza, you kind of cut out a little bit, but you shared some really great points about your sleep and your menstrual patterns. Those are both really big things. It sounds like other people are agreeing with those. And then also someone said, Dr. McClintock said back pain. Yep. And other people are agreeing. Yep. So thank you guys for sharing.
Yeah, for me, I also find that when I'm more stressed, I get a lot less physical activity. And that kind of compounds my stress because that's a good stress reliever for me. And I feel more healthy when I'm able to be active and exercise. So all these things are so intertwined. So I'm going to move on to the next topic here. Want to preface this by a caveat that I racialize as white and I'm not an expert on this at all and don't experience racism in my life personally, but I want to share these kind of facts that affect pregnancy and birthing a lot too, and tie stress into that. So a big source of stress for people of color is experiencing racism in their day-to-day life. And experiencing racism definitely affects people's health. These two tidbits from some research found that Black women between the ages of 49 and 55 were found to have a biological age 7.5 years older than white women of the same chronological age. And they used the length of the telomeres in their DNA, which is sort of a biological marker of aging. And then so they also found that exposure to racial discrimination and segregation in childhood was more predictive of inflammation in adulthood than the traditional other risk factors such as diet, exercise, smoking, and low socioeconomic status. So even people who had the exact same diet, same amount of exercise, and smoking and socioeconomic status, those who experienced racial discrimination had higher inflammatory markers, which absolutely affect our physical health and can cause disease as well. So specifically related to birthing and pregnancy, they have found that Black birthing people exposed to racism in the year prior to giving birth were more likely to have an infant with low or very low birth weight. And when we start to look into a lot of the inequities and disparities between white people and people of color in our country, we are sort of finding more that it is actually exposure to racism that may be causing both the birthing person's poor health outcomes and the infant's poor outcomes, that is all related. And then there's this concept called allostatic load, which is really related to all types of stress. And allostatic load is sort of a measure of the combined biological manifestations of chronic stress over one's life. And that is the term that we use to explain how chronic stress can cause poor health. And the idea is that, like, with constant exposure to stress, normally when the stressor goes away, we can kind of return to our baseline calm state. But in folks who are constantly exposed to stressors that don't go away, such as racism in the United States, their body stops being able to return to like a calm state, and that level of stress is always there, and is theorized is what's causing a lot of poor health outcomes. So next, I want to just share some data that when I saw this, it really stuck with me, and I think it's really important to know about. So this is a table from the CDC that looked at maternal mortality, and the metric here is number of deaths per 100,000 birthing people. Also, maternal doesn't necessarily mean women, it's anyone who can be pregnant. And they specifically looked at people based on their education status. So whether they got less than a high school education, some college education, or have a college graduate degree. And I think a lot of folks kind of presumed that both education status and potentially socioeconomic status, and those are somewhat linked, would have more of an influence on the rates of maternal mortality than race. And what these numbers show, I think the most important thing to look at here is that white people with the less than a high school education, so the least amount of education, still died at a lower rate than Black people who had a college degree. So that is just striking to me, that if you think that having college education, and maybe this isn't directly related to income, but have a higher socioeconomic status potentially, like, does not protect Black women from dying during childbirth. And it is theorized that it's actually like people's exposure to racism and to stress in their lives that is causing people to die during pregnancy. And that relationship also exists for American Indian and Alaska Native people as well. Interestingly, less so for Asian and Pacific Islanders and Hispanic people, but just really wanted to highlight that disparity between the white and the Black folks in this data. Okay, so that was heavy. Let's take a moment and we can move on to Jazzy's gonna talk about this next topic.
Yes, thank you for sharing that. I don't know if anyone has watched the documentary. I think it's called When the Bough Breaks, and there is that section on maternal health. And it was actually that documentary that made me become a doula, because of the just awful racial health disparities that Black women face. And that study where they tried to factor out for education and higher income actually was like Sarah had said, like proof that like when you take those factors away, there's still something else going on, and that something else is racism and the effect of racism on our bodies. But one unique thing about women or people like female identified folks is that kind of this theory started out in like the around like 1995 time frame. Up until that point, a lot of the research around stress was very male dominated. Only about 17% of stress research participants were women. And it was theorized by Dr. Shelley Taylor from UCLA that women may have evolved their own unique stress response in order to protect themselves while being pregnant, nursing, or caring for their offspring. She worked in the Department of Psychology and created this theory called the tend and befriend theory. And according to this theory, under stress, females tend to their young and befriend other females around them who might help. And this close connection as well releases oxytocin, and which is a hormone that also elicits more empathy among people, and it allows us to have create a more of a systematic network of support for us that are meeting with other women. And I thought it was really interesting because there's also a lot of offshoot studies from her original work, that's spending time, when women spend time with other women, at least twice a week, which might be hard for many women that like have jobs and have families and everything like that. But it can even be like, as long as you're being intentional, like a phone call check-in, Zoom check-in with friends, twice a week, that those women actually have like healthier outcomes than women that don't have that group of that girl gang that they can go to, I guess. And you really don't have to have a large group of friends. It can just be like one or two close friends. But that's something that I really love about Mom's Corner as well, because it is kind of like this group that we can get together with women all over the world and kind of talk about important issues, and be vulnerable like we have been today, by sharing our stories. So I guess I have another question for you guys, is like, thinking about everything that we've talked about today, what has been your emotional and physical reactions when you're under stress? I think we like shouted out a lot of like ways that we might have, but it's like when we were talking about this and like how it can really impact us, what are some ways that you can think of in a little bit more detail? I have an idea, but I will wait because I'm really interested in hearing what other people have to say.
We have some answers in the chat. Someone said heavy breathing. Totally feel that. And also distraction.
Yes, thanks for pointing that out. For some reason, my chat like went away.
And then Dr. McClintock said one of the first things that she does is call her mom or her best friend. Such a good one. A positive an adaptive response to stress to try and calm yourself down, right? Sweaty palms is another one. Yeah. There's like unintentional reactions that our body does, and also sort of behaviors that we do to try and respond to our stress. Picking my fingers. Yep. Biting my nails is what I do.
Mm-hmm. I do. I like pick the skin around my nails. I think Sarah, Dr. Hemphill, you had said something that really resonated with me. I think that like when I'm stressed, it might be something that's like the chronic stress that we deal with work and feeling like behind in literally everything in life. And then thinking about then how to navigate that as like a woman of color in medicine on top of that. And then I feel guilty for like wanting to do something fun or relaxing, or I'm just like, I just can't, I just need to sleep. But then I'm not even really getting good sleep, or I just am like laying in bed and I'm like scrolling on Instagram for hours. And I'm like, wow, I could be doing so many other things. And then like, that's like another, like, I'm like in another guilt cycle. And it's hard then to like do the healthy things when I'm like, I just get wrapped up in the stress.
Yes, getting sucked into the phone scrolling is so relatable for me.
Same.
Well, thank you all for sharing.
So I'm curious what you guys would guess are the percent of visits at a family medicine clinic that are related to either stress or lifestyle. So examples of lifestyle things are like diet and exercise, and managing stress, sleep. What are some of your guesses? And it's okay to be wrong. Okay, 80, 90, 85. You guys are really close. It's 70, and it's probably more. But at least 70% of the visits are about lifestyle in the family medicine clinic. We sort of talked about before, and some of you guys have mentioned, if you're stressed, you're less likely to engage in healthy behaviors. So I can really relate to the ice cream one. I'm actually eating ice cream as we speak. Dr. Hempel was saying how she sometimes exercises less when she's stressed. They're all kind of intertwined. I think that's why a lot of our visits are related to those things. And stress is also related to chronic diseases. So the chronic diseases that kind of come along with a lifetime or a long period of time of those kind of maladaptive behaviors, like exercising less, maybe choosing less nutritious foods, more frequently getting a lack of sleep. So I think, yeah. So I think there are different ways that we can kind of handle that stress, and we also talk about that in the clinic sometimes.
That's such a good point, Dr. Miller. And actually your point on its connection to chronic disease, and something that I forgot to mention earlier, right, that I had meant to mention on an earlier slide, was just trying to highlight sort of the way stress can impact, I think we've sort of highlighted depression and anxiety and how that makes us more at risk, but also thinking about chronic diseases like hypertension or high blood pressure, or even like specifically around pregnancy, because I know we talk about pregnancy adjacent topics often on Mom's Corner, but something called preeclampsia that I think we've discussed on prior episodes or Mom's Corner meetings. Preeclampsia is essentially when you have really elevated blood pressures, and then also some other systemic signs that are that something is going wrong with your health during a pregnancy. Stress can put you at a much higher risk of that via its connection with increasing risk of high blood pressure. And I think a lot of the behavior responses that many of us mentioned we engage in, and I think the general population is no different, but around nutrition and physical activity can put us at higher risk of things like diabetes or gestational diabetes. And so it is not only impacting our mind, but also our physical health. And with that in mind, so this concept of mindfulness is something that we talk about, or I feel like for a long time I heard it talked about, or I sort of tried to engage in that conversation, but wasn't really sure exactly what mindfulness meant. And essentially what this is when there's something that's stressful going on, and I think all of us have and will continue to probably be in situations that are stressful throughout our lives, being aware that it's happening and like intentionally aware that something is stressful to you, and being aware of what your response is, whether it's a change in like a vital sign, like your heart rate is going up, or you're feeling anxious, or you notice that you're starting to engage in one of those behaviors we were talking about, like scrolling your phone, or like withdrawing into yourself, or picking at your nails, or whatever it may be, being aware that that response is happening, and then and the emotions that are coming along with it, and then making a deliberate choice in that moment of how you want to respond. So it's a lot of being mindful or just present in the moment of what is going on and how you're physically reacting, and then trying to stop that cycle, which can be hard to do.
So does anyone have, I guess, what are some ideas you have about what people could do to reduce stress and be more mindful? Or what are some examples of things that you might do?
Being really in the moment and paying attention to Dr. Kime was saying, about what you're doing. Like if I'm having a piece of cake and really just like bringing my entire self to that piece of cake and being in the moment, enjoying it, like, I'm tasting it, just being focused, I guess, in that sense. If I was to give an example, just paying attention to what I'm doing and aware of how that's kind of affecting my body.
Yeah, that's a really good example. There's actually one of my favorite mindfulness techniques is to kind of be in the moment, and then think about something that you feel from each of your 5 senses. So, what does this taste like? What do you smell? What do you hear? What do you see? So that's really great. Thank you for sharing. Well, there's some more things in the chat here. We have journaling, baking and cooking, talking it out with family, and then meal planning, petting or playing with cats, same, stretching, that's a good one, being outside in nature, and prayer. So that's a ton. It sounds like you guys all have a lot of really great coping strategies. Prayer as well. Someone else that resonated with. And one thing I wanted to add is something that was really big for me is I think when I sometimes have negative emotions or stress, there's a part of me that kind of, tells myself to calm down or wants to kind of shut that emotion down. But really thinking about like being kind to yourself and saying, of course, maybe reasons why you deserve to be stressed, or thanking your body for sending you this signal. Maybe it's sending it to you to kind of help you out, and then say, all right, like, thanks for this warning, and then moving on. And then prayer, definitely, meditation and writing. Yeah, those are some really great ones. Does anyone have any barriers that make it hard for them to do these strategies?
I think for moms, it's really hard to really find like, a designated area in your space in your house to find that moment where you should have mindfulness. But I've learned to kind of what I call still moments, like don't, whenever you get a chance, just to kind of in that space, focus on what's happening. If there's so much chaos happening around you, but still trying to maintain some semblance of control, if you will. And also teaching my own kids, like, if something happens, it's not the end of the world. Let's take deep breaths. What can we do to what steps can we take to rectify whatever is happening, so that they can kind of learn to control their emotions and depend on themselves to kind of self-regulate.
Thanks for sharing. I think your kids are really lucky to have you as an example, because not everyone gets to learn so much. Yeah. That's really great. And yeah, everyone is also saying like running a family, just life in general. And then Sarah said just this culture that we have in the US, which is that you should always be doing something with your time. So even when you're on vacation, you feel like you should be, even if it's like you should be learning something else, or reaching out to friends, or training for a marathon, or holding a community gathering. There's kind of this discomfort with just relaxation and taking time for yourself. Yeah, productivity creates culture, absolutely. And it's really hard to free yourself of that mindset when you are reminded all around you. So I think kind of in closing, we've talked a lot about different things that can cause stress, the effects that stress can have on our health, and then different strategies that we might use or we might have heard of for handling stress. And I wanted to share, I'm sorry, we don't have a visual of it, but there's this kind of goal setting technique that we use a lot in medicine called a SMART goal. And I was hoping that everyone, and you don't have to share it, could kind of think about a goal that they want to set for themselves for reducing stress. And the aspects of this SMART goal, just to keep in mind, are that it should be specific. So it shouldn't be, it shouldn't be, for example, I want to get fitter. It should be, I would like to run more. And then it should also be measurable. Okay, so Kimi is putting in the chart. It should also be measurable. So something, 30 minutes or 2 days or something that you can measure. So it usually means it has a number in it. It should be achievable. So set a goal that you think that you can actually reach, even if your dreams might be very large. And then it should be relevant to what you're trying to work on. And it should be time bounded. So there should be a goal for when you're kind of going to reassess how you're doing on your progress. So I think if anyone has one already, feel free to share. And if not, you can kind of write it down and keep it to yourself, but I already see one. Okay. So someone wants to journal consistently because you find a lot of solace in writing. I think that's really great. I think one of the things that can help is exercising after childbirth. Right. These are amazing goals. The cool thing about the SMART goal is that it kind of breaks it up into a little bit more manageable steps. So an example and I don't know if this is true for you, but for maybe if Jazzy wanted to journal more as well, she could say, I want to journal once a week or every Wednesday for the next 4 weeks for at least 10 minutes. So that's so specific, and it's pretty manageable because it's not so nebulous. Sometimes when goals are so big, like exercising after childbirth, that's a huge one, and that could mean so much. Sometimes that's overwhelming, so you kind of don't know where to start. So I encourage you to think about maybe like something that's really manageable. So like 5 minutes of exercise a day, something like that. Okay, so Zainab says stretching or light workout for 30 minutes 4 times a week. So that's really good. It's really ambitious. That's very good. That would be awesome. And I like that it can be stretching or light workout. So it's just kind of like moving your body and doing some physical exercise in a way that feels right for you that day. I love that. But those are all really good goals. We just wanted to share this kind of mnemonic that we use sometimes to help make things more manageable.
That is all we have. I'm going to stop sharing. Does anyone have any questions or comments or reflections about all of that?
Several. I just want to kind of give the floor to our guests and see if they have any questions.
I like the fact that, these things, they don't just have to be people doing yoga or, you know what I mean? Or breathing techniques only. Like, there are things people do to help them, distress. And they just sort of need to, name those things and exercise, you know what I mean? Like using them often, because often when people think about this, like I said, it's the Western mind of, like having to go for swimming or, some things that aren't culturally ingrained in other cultures. That's what some people would think is, but there are various ways of, just finding what your tools are to help you.
Absolutely. I think there's also a question in the chat. There's Sid.
It's such a good question. And it looks like so the question in the chat was, how do you motivate yourself to stay on these self-care activities? And Dr. Abraham, accurately, I think it's such a good question, because that's the hardest part. I think all of us probably know some of the things we want to do differently and can, sit down and make a smart goal. But it's really hard to make yourself do it and make yourself stick to it. And Dr. Abraham points out, like, thinking about the people in your life that can hold you accountable, or maybe having a buddy that you engage in that smart goal with.
I think one other big thing is like making these changes in your life really gradually and make them things that aren't too much deviating from your normal routine, so that it doesn't feel like you are really having to expend too much extra energy to do something. And then it eventually will become part of a routine that will become sort of second nature. But it's really challenging, and we are definitely struggling with the same things.
I see a comment in the chat also. How does stress affect labor? I think that's a great question. And anyone can feel free to add in as well. But I think one thing that I see is, and maybe this is less stress, but more how much, what are a person's stress coping tools that they have. And I think it's a good reminder right now, while, like, for me, I'm currently not in labor, but if I'm practicing regularly some sort of small stress reducing technique, I think a couple of people mentioned like a breathing technique, or like a mental thing I'm blanking on the word, but something you say to yourself in times when you're stressed, like, I am enough, or I can do this. And if you have sort of a practice that you engage in when you're not in labor, or not in times of affirmation, thank you so much, Jazzy, or when you're not in labor or in a time of intense stress, then it's easier to call on those techniques when you really need them. And I can say for myself, for example, I used to be really triggered by things that looked painful and needles. And so, like, before I went into medicine, I actually saw a counselor for a little while to work on grounding techniques, so that I could have tools to use and could call on when I felt under a lot of stress physically from something that was mentally triggering for me. So that now when I do feel like I'm having a response to something that one of my patients is going through that looks really painful, I can sort of mentally call on that, some of the grounding tools that I use without being even too conscious of it. I can call on them and sort of mentally calm myself down and bring myself back in the moment, so I can be there to support a patient.
Dr. Kime, that's such a humanizing experience. Thank you so much for sharing that. It really helps to put in perspective, like, even, great doctors experience this, but they have coping mechanisms in place, and that it is possible to have those and be functional as a human being.
To respond to the question, there was a question, can stress lead to heart attack or stroke? I think yes, absolutely it can. Most of the time it's sort of over many, many years of being under a lot of stress. Like we were saying earlier, people are more likely to have conditions like high blood pressure, and high blood pressure are things that do lead to heart attack and stroke. And so being exposed to high amounts of stress over a long period of time definitely increases our risks of having those things.
Doctor, just to follow up on that, I as a person of color, I understand that, but for someone like if there's a white person questioning, like, well, Black people, it's been years, since decades since slavery. Why is it that it's not because institutional or whatever racism that is making them unhealthy? What it's some other thing? How would you, like, I guess not convince, but explain to someone like that, with that frame of mind, like, this is something that is like real, and that it's affecting people of color more than not white people.
I'm so glad you asked that question. I'd love for my other colleagues to chime in too, but I guess I would say kind of what I was talking about earlier, that exposure to racism in folks' day-to-day lives is causing their body to be hyperactive all the time and release these chemicals that do cause stress and damage in the body. And slavery has not ended. Like we all are still living in a world where racism exists and people experience racism every single day, and that is having tangible impacts on their body, like in a psychological way, but also like a chemical and physical way.
I think also there's really good data out there that shows that even when they control for socioeconomic status, even when they control for educational status, kind of like Sarah was showing us earlier, there are still adverse health effects for people. And the only factor is really racism. I don't know off the top of my head any exact studies, but I can try to find some, if you think it would be helpful, and send them to you if you would like to read them.
We have a couple on the sources slide here as well. I think also like there's so many layers of racism. There's like internalized racism, there's interpersonal, there's institutional, there's structural racism, and all of those layers affect us. And then in addition, if you have any other marginalized identities, that is compounded into the stress effects that you will see. And on top of that, there's like the term like microaggressions or micro racisms, like those aren't in actuality micro, like you're dealing with these, multiple microaggressions every single day, and that adds up as well. So like there to say like, oh, this slavery ended, okay, like maybe in like the way that like we hear about it in history, but also like slavery, like the prison industrial complex is like the new slavery, and there's like the cradle to prison pipeline that many people of color have to fear, really. Like how many of us have gotten the talk or had to like have the talk with your brother or your sister or your sons or daughters about like needing to be careful when you're on the street, and like how to interact with the police because your life is on the line, literally.
Yeah, thank you all for sharing these statistics and the research and all that. And as a Black woman, I know that these things exist still, that what I mean, that slavery is over, that Black people are not free to, what I mean? And it has left so much, like somebody was saying earlier, in the DNAs of so many African Americans, what I mean? But my thing is, like, how do you all as doctors, how do you sort of, show up for Black, and what I mean, for Black people, knowing that all this statistics, knowing that somebody is coming in and is showing all this medical conditions that are stemming from like stress, what I mean, stressful things in their lives. Like how do you all show up for Black folks, right? And because what I know is, and I know some of the doulas on the call will affirm this, is that oftentimes people like labor and delivery, right? People would see somebody who is like, when we're working with Black families, them being difficult, them being, what I mean, and things like that. So like, or somebody comes late to an appointment, it's automatically assumed, negative stuff, not realizing this person took 3 buses to get to your appointment, and now they're 10 minutes late and you are, all this stuff. Just as an example, like, how do you, as an individual, like, what are you doing? What are you all doing to sort of amend this sort of thing, right? With the people that you're working with who identify as Black, or like your institution, like what are things in place that your institutions are doing to sort of help leverage the, what do you call, your Black patients, right? I don't know if I'm making sense, but because research is one thing, we all know that, the disparities are out there, but what are we as individuals who are also in a place of power, what are we doing to sort of help eradicate this, this thing called racism that we are alluding to is like stemming from everything that we just talked about?
Yeah, great question. I can give one example of something that I'm working on right now. It's my quality improvement project for Swedish. It's like actually it's a Providence-wide thing. Every clinic that's participating is doing a little project differently. But we talked about like how stress can affect the like our heart and our the vessels and cause high blood pressure, which then can lead to like heart attacks and strokes. And actually, there's pretty grave statistics for Black identified people and their rates of high blood pressure, and that it's largely like uncontrolled because it is kind of like a silent disease until it explodes and you have a heart attack or you have a stroke. And so we implemented a new policy at our clinic, and Kimi has a similar at her clinic. There's a similar resident doing a similar project, but for us, it's like anyone that has a blood pressure above a certain limit, they get a repeat blood pressure and they automatically get if that's still high, because sometimes our blood pressure is just high and that's why we recheck it when you go to the doctor, because it just this like the white coat high blood pressure, just being the stress of being at a doctor. But if it's still high, then they like automatically get another visit with the doctor where they only just talk about blood pressure, and we give them some information before that visit on like lifestyle management of diet and exercise, and then we make sure that like they're on the appropriate medications for that as well. And that is actually even like a bigger topic on racialized medicine and how a lot of like for many years, the calculations for like how we look at our kidney status and function has been racialized. What medications are more effective for Black identified folks, which is actually like different than white identified folks. And even though like there's multiple studies that say like the best medications, like blood pressure medications for like protecting your heart and your brain are ACE inhibitors or ARBs, and that's not like the first line. For many years, it was taught that wasn't the first line for Black identified people because it just didn't work as well, but actually that's not true. And so like making sure that like we are being aware of the research that we're digesting, and then trying to like incorporate that into our care. And so like being aware of racialized medicine and making sure that like our patients are like we're looking at the blood pressure and we're making time for it, because you come in sometimes not wanting to talk about your blood pressure, but as your doctor we have to also make sure that we're going to take the time to address what you came in for, but also make another visit to address this other thing that we're seeing, because that has such a profound impact on your life, and is definitely affected by racism.
I think another thing is I didn't know a lot about kind of the role of doulas in reducing maternal mortality before I came to Swedish. And it's part of our residency training to learn about that, to have doulas come and speak with us as residents and to learn like how to work together, and how to best support doulas on the L&D floor. And I think there's always room for improvement, but I think that's one thing that the family medicine residency has done.
Yeah, I was just follow up an example of that. My husband works in medical field, and he was saying like how some patients, a white patient comes in with like like being stressed, they're diagnosed with having ADD, and if a Black person comes in exhibiting the same symptoms and wanting what do you call medication, they're perceived as like being after drugs or being a drug addict or something, and kind of just sent their way. So it's consistently you have these institutions and systems that are constantly working against you by the dominant culture that has orchestrated and perpetuated by white supremacy, and it just continues to hinder growth and progress for many communities of color, and that's one of the reasons why most of them are being affected.
Yeah, I think that highlights such a good point, that I think earlier when we were talking about all of the ways that our body holds on to long-term stress related to racism and discrimination. I think an important piece of that is not only the impact that many Black and Indigenous people of color are experiencing throughout their lives, but when they come into a medical setting, they're also probably in real time experiencing bias or discrimination or other manifestations of racism. And so that sort of ends up working in two ways. One, that probably discourages them from wanting to go back to see a medical provider because it was such a negative experience. And so that delays their care in the long term, specifically thinking about like chronic diseases. And I think it adds to, in the future, when they do end up presenting for care later on, whether it's for the same chronic disease, like high blood pressure or diabetes, and that disease has advanced further than it might have if they had initially a positive experience. But also when they're coming in for acute care, like during pregnancy and labor, they're expecting something negative, and so it automatically means that they're not able to engage in a trusting relationship with a medical provider. And I think that probably as medical providers, oftentimes they sense that, and it sets the whole situation into a more of a negative space. And I think as medical providers, we need to be especially cognizant of that. And I think someone put in the chat in terms of it's on us to make sure that we are regularly going through implicit bias training and sort of evaluating our own numbers, looking at like of our patients who come in for a certain chief complaint or a certain issue, almost everyone should be getting their blood pressure checked when they come into the doctor's office. Of those patients who come in for that kind of complaint, are they getting prescribed a medication if they're meeting a certain criteria? And you can look at, as a provider, you can look at your numbers from the data, because now that we're all using electronic medical records. And so it's important for us to be continually engaging in implicit bias training, and continually sort of self-evaluating and reflecting, not only via sort of more qualitative reflection, but also the quantitative side of that too, and looking about what our practices actually, and broken down by race. But I think you bring up such a good point, or the point that your husband made. It's unfortunately very true. And like Sarah said in the chat, I think one issue that we talk a lot about at our residency is what language are we using when we describe patients. And she says that oftentimes patients of color will be called non-compliant, when really maybe it's probably there's a multitude of other reasons that are preventing someone from adhering to a medication regimen. And probably one of the biggest ones is that the provider may not have done good counseling to begin with. And so that's really on us.
Yeah, one that we see often, with the birthing, within the birthing community, when attending births, is that when a Black, couple is advocating for themselves, that they are being difficult, right? Like they're bothering the nurse, they're just asking for things, or like, they're not taking recommendations from the doctor's mouth, like they want, to talk about it or whatever, right? And then when a white couple does it, it's the advocating for themselves. Do you know what I mean? So it's just, even the language, it's yeah, it's just sad, but I'm glad to hear that some of the work that you all are doing. And I think, it's not all about just getting an implicit bias training. It's about implementing, you know what I mean? Because how many people do get those annually and then they just attend the 90-minute whatever and then check off and then they're done. But they're not really enacting anything they learned from those things, So it's exciting to see, you all doing this stuff already, and you are sort of just, beginning your journey as, what I mean, as doctors too. So hopefully things would change with you all. So.
Does anyone else have any more comments or questions for our doctors before we let them go? I think silence speaks volumes, so I will stop. We will stop there. I'm so sorry again about my camera. Doctors, it was so good to see you. Thank you so much. What an amazing discussion that we had today, and so just for bringing your knowledge and expertise to us again. And I thank you for your advocacy on behalf of not just patients of color, but all patients. And we cannot wait to see you next month. I am not sure if we have a consensus for a topic yet. I was thinking, like, I don't know, demystifying or like debunking medical, I don't know, like medical conditions that people say, have in mind, like if you eat too much of this, gives you this, but just kind of debunking. I don't know, I have to come up with a better title for it. Yeah. Like when I was little, people used to say if you eat a lot of ice, your boobs will get bigger. And I was like, wow, that's great. It's so much ice still, but not as big as I would like them to be, but something like that. Yeah, yeah, along those lines. Yeah, so we will stay in touch and email you all about that. But thank you so much for coming through again. And thank you to our amazing moms and women folk for coming through as well. Really appreciate you guys. Have a good night, everyone. Thank you.
Thank you so much.
Well.